Have you ever stopped to think about what you would do if you had a heart attack? Completely alone. According to the Centers for Disease Control and Prevention (CDC), approximately 805,000 people in the United States experience a heart attack every year, and about 85,000 of those are sudden, unexpected, and often occur when individuals are alone. What makes this so alarming is that heart attacks don't follow a schedule. They can strike anywhere and at any time. Whether you're driving, working at your desk, shopping at the grocery store, or relaxing at home. Now picture this. You're alone, and no one is nearby to help. What you do next could literally mean the difference between life and death. But don't panic. In this video, we'll walk you through simple, practical, and potentially life-saving steps that can significantly improve your chances of surviving a heart attack when you're by yourself. Stay with us until the end, and if you find this information helpful, please give us a like, subscribe, and share. You might just save a life, maybe even your own. Cardiovascular diseases, including heart attacks, are the leading cause of death globally. According to the American Heart Association, 1 in every 5 deaths in the U.S. is caused by heart disease. A heart attack, medically known as a myocardial infarction, occurs when blood flow to a part of the heart is suddenly blocked, usually by a blood clot in a coronary artery. Without oxygen-rich blood, heart muscle tissue begins to die, and this damage happens fast. Every minute counts. Ideally, you'd receive immediate emergency care, but reality often plays out differently. When you're alone, having the right knowledge becomes your most powerful weapon. So what should you do? Step 1. Recognize the symptoms immediately. The first and most crucial step is to identify the warning signs early. While severe chest pain, often described as a feeling of pressure, squeezing, tightness, or burning, is the most well-known symptom, not all heart attacks feel the same. You may also experience chest pain or pressure that lasts more than a few minutes or goes away and comes back. Pain that spreads to the left arm, neck, jaw, back, or stomach. Shortness of breath, even while at rest. Cold sweats that appear suddenly. Dizziness, lightheadedness, or a feeling like you might faint. Nausea or vomiting. Extreme fatigue or weakness. Pale or grayish skin tone. A feeling of impending doom or intense anxiety. According to estimates, nearly 200,000 people suffer a repeat heart attack each year, meaning early symptoms should never be ignored, especially if you've had one before. If you feel anything unusual, don't chalk it up to indigestion or stress. Denial wastes valuable time. Accept the situation and act immediately. Step 2. Call emergency services immediately, don't delay. Even if you're completely alone, your phone can be your lifeline. Call 911 or your local emergency number as soon as possible and clearly state that you believe you are having a heart attack. Provide your location or address, and if you're using a smartphone, put the call on speaker mode so you can use your hands while following dispatcher instructions. Never attempt to drive yourself to the hospital. You could lose consciousness behind the wheel and cause a crash, putting yourself and others at risk. Time is heart muscle, and the longer you wait, the more permanent damage may occur. Step 3. Sit or lie down in a comfortable position. Next, reduce the strain on your heart by finding a safe and comfortable position. Ideally, sit down and elevate your upper body slightly, using pillows or by leaning against a wall. This semi-reclined position can help make breathing easier and reduce the workload on your heart. Avoid unnecessary movements. The more energy you conserve, the better your body can focus on survival. Step 4. Take an aspirin if it's safe for you. If you have access to aspirin and you're not allergic and have previously been advised by your doctor to take it during suspected heart symptoms, chew 1 regular strength tablet, approximately 300 milligrams. Chewing allows the medicine to be absorbed more quickly through your mouth, helping to thin the blood and prevent the clot from growing. If you're unsure about your tolerance to aspirin, don't risk it. Also, don't endanger yourself by searching through hard-to-reach places for it. Your first priority should always be calling emergency services. Step 5. Control your breathing and stay as calm as possible. This may sound impossible, but staying calm is essential. Panic triggers a surge of stress hormones, which can increase your heart rate and blood pressure. Exactly what you want to avoid during a heart attack. Try the following breathing technique. Inhale slowly through your nose and count to 3. Exhale gently through your mouth and count to 3. Repeat while focusing on something still, a light, a painting, or a calming word. The American Heart Association emphasizes that mental composure during a heart event can significantly reduce oxygen demand, helping your heart do less work under stress. 6. Avoid unnecessary physical effort. This might sound obvious, but it's crucial and often underestimated. Do not engage in any activity that requires physical exertion. If you're experiencing a heart attack, your heart is already under severe stress and struggling to pump blood effectively. Every extra movement, whether it's reaching for something far, climbing stairs, or attempting to walk across the room, increases the heart's demand for oxygen. This can speed up damage to the heart muscle and worsen your condition. Instead, stay as still and relaxed as possible. If you are in a potentially unsafe area, such as a bathroom or outdoors, move carefully and only as much as necessary to reach a more secure and comfortable place. Conserve every bit of energy. Your life could depend on it. 7. Loosen tight clothing to improve breathing. When a heart attack strikes, every breath becomes precious. Tight or restrictive clothing can worsen your symptoms by making it harder to breathe and by limiting blood flow. If you're wearing items like a tie, a tight bra, a snug belt, or a shirt collar that feels constricting, loosen or remove them immediately. This simple act can increase your comfort, help ease the feeling of suffocation, and enhance oxygen intake, which is vital when your heart is in distress. 8. Avoid eating or drinking anything. During a heart attack, it's best to avoid putting anything in your mouth. No food, no drinks, not even water, unless directed by a medical professional. This is because your body is already under duress, and eating or drinking may increase the risk of choking, especially if nausea or vomiting occurs, which is common during cardiac events. Introducing food or fluids at this critical time may also interfere with emergency medical treatment. Your primary focus should be to remain conscious, breathe steadily, and wait for help without complicating the situation further. 9. Stay alert and monitor your symptoms. As difficult as it may be, try to observe and track what's happening to your body. Is the chest pain getting worse or spreading to other parts like your jaw, arm, or back? Are you feeling numbness, confusion, or extreme fatigue? Any information you can recall and share with first responders will be invaluable when they arrive. Also, do your best to stay conscious. If you feel like you're going to faint, try to lie down or position yourself where a fall won't result in injury. Your awareness and safety matter greatly, both for your own well-being and for the emergency team's effectiveness when they begin treatment. 10. Plan ahead to prevent future emergencies. While the previous steps focus on immediate survival, this one is about long-term prevention. Heart attacks often strike without warning, but many risk factors are known and manageable. According to the CDC, high blood pressure, high cholesterol, diabetes, obesity, smoking, lack of physical activity, and unhealthy diets are all significant contributors to heart disease. If you identify with any of these, don't wait for a crisis. Consult your doctor to create an emergency action plan. Keep your phone charged, share your medical details with close contacts, and store aspirin or prescribed medications in easy-to-reach places. Even small changes can yield massive benefits. Eat a heart-healthy diet, reduce sodium and saturated fats, quit smoking, manage your weight, stay physically active, and attend regular checkups. The American Heart Association recommends at least 150 minutes of moderate physical activity per week, combined with a diet rich in fruits, vegetables, lean proteins, and whole grains. Managing stress, improving sleep, and addressing unusual symptoms early, like chest pain or chronic fatigue, can drastically reduce the chance of a future attack. These life-saving tips are not a substitute for medical treatment, but they could significantly improve your chances of survival during a heart attack, especially if you are alone. Preparation, awareness, and quick action can be the difference between life and death. If you've ever experienced a heart attack while alone or have advice to share, leave a comment below. Your story might help someone else survive. If you found this information helpful, type "yes" in the comments and share this video with your loved ones. Knowledge is power, and in this case, it could save a life, maybe even your own. Don't forget to like, subscribe, and check out the 2 recommended videos we've selected for you next. They're packed with more heart health tips and prevention strategies. Thank you for watching. Stay safe, stay informed, and take care of your heart.